Good evening, everyone. I'm delighted to welcome and thank you all for joining the Capital Health Network's webinar, Secure Messaging, Adopting Digital Referrals in the ACT. I'm Kayla Carriage, the Digital Health Project Officer in CHN, and I'll be facilitating tonight's webinar. Before we start, I want to acknowledge the traditional custodians of the land we are meeting on, the Ngunnawal people. I wish to acknowledge and respect their continuing culture and contributions that they make to the life of this city and this region. I would also like to acknowledge and welcome any other Aboriginal or Torres Strait Islander people who may be attending tonight's event. Before we start, just a little bit of housekeeping. All participants have been muted. Please address any questions to the All Panelists chat in the side panel of your Zoom window, and we will answer them in our Q&A session, which will follow the presentation. This presentation is being recorded, and the link to the recording and other resources will be sent to you after the event. By the end of this activity, participants should be able to adapt their practices to include ACT HealthLink SmartForms to ensure referrals are received and properly triaged by Canberra and Calvary Health Services. Describe the function and role of ACT HealthLink SmartForms and Specialists and Referrals, also known as SR Referrals, when referring to Canberra Health Services and private specialists, and use My Health Record to improve access to vital patient information and help in your clinical decision-making. Without further ado, I would like to thank our guest speakers for their contribution in the delivery of this educational event and introduce you to our first presenter. To talk about SmartForms for referrals to outpatient services, please welcome CHN's Digital Health Manager, Russ Trinidad.
Good evening, everybody. I am Russ Trinidad, and I'm the Digital Health Manager here in CHN. So I will be discussing the SmartForms Electronic Referral to Canberra Health Services and Calvary Health Services. I think some of you have known that Digital Health Record is coming this 12th of November. And with that, HealthLink SmartForms will be integrated with Go Live. Initially, it's only Canberra Health Services who is linked to HealthLink SmartForms, but good news, Calvary Hospital will also be included. So that's why we are doing this webinar. It's because the preferred method for referrals to these hospitals will be HealthLink SmartForms. At present, there are 124 GP practices using SmartForms with 38,869 referrals received by CHS. So what are the benefits of using HealthLink SmartForms? First and foremost, most of the GP management software are integrated with HealthLink SmartForms. So GPs can just click a button, encode all the patient details and submit the referral to CHS and Calvary. Once that referral is submitted, you will receive an acknowledgement with a date and a timestamp. Also, a record of that referral is in the patient's file in your practice management software. From Go Live, as I've said, Calvary Health Services and Canberra Health Services will be able to send you status updates, such as confirming acceptance of your referrals, rejections, triage, and in the later part, appointment bookings as well. Because DHR also has a component where patients can also access all these things. So, using HealthLink SmartForms, it's quick and it's easy, but it requires a move away from our old habits of faxing or emailing, which we all know is not a secure way of sending referrals. So what can you do at this stage? I know we've got just a few weeks away from the Digital Health Record Go Live. If your practice is not using HealthLink SmartForms, and by the way, this is not just for GPs, I know that specialists can also send referrals to CHS and Calvary using SmartForms. So if you haven't done it yet, get the training manual, train your staff, have a play on your test patients. If you have colleagues that are using SmartForms, talk to them, ask them what their experience is. I know there are some pain points, but majority of the feedback that we are receiving lately is that a lot of GPs are now finding it easy to use HealthLink SmartForms. If you have questions, you can contact CHS GPLU. The numbers are here on the screen, and the email address is here as well. Or you can contact our team, CHN Digital Health Team, and the Quality Improvement Teams. We are willing to visit your practices so that we can support you in using HealthLink SmartForms. Another option is to contact HealthLink support, and their number is 1-800-125-036. Just some things to think about. As with any IT platform or software, nothing is perfect. There will sometimes there are glitches, but the end result, more referrals are being sent to the Canberra Health Services, and they are receiving it, they are processing it properly. That's what's important. Issues and IT glitches can always be solved with the help of HealthLink support IT team. We also know that for those who are using medical director software, that you still have to manually encode the medication dose value. But I know that medical director is looking at this. Another thing, it takes time to get used to something new. I know, especially if we're using faxes or emails, shifting to an electronic way of referral takes time, takes experience, and getting used to. It also needs to be incorporated in your daily practice workflow. So it's good not just for GPs, but for practice managers and the staff to know a little bit about using this new system or this platform. Another thing to consider are the attachments. So there were feedback from some practice managers and from some GPs. They're saying that, Russ, the attachments, they're not accepted, or they are not being sent together with the referral. You'd have to really check that the attachments that you are attaching with the referral are the recommended file types. Some types or some documents are not accepted as attachments. So those are just some things to consider when using HealthLink SmartForms. Keep at it, keep testing using your test patients, keep sending referrals using HealthLink SmartForms, and it will get easier in time. Just to give you some statistics, so SmartForms started in 2019 with 211 referrals. And every year usage increases. We also receive referrals not just from ACT practices, but also from other states. And from June up to present, we are closely working with Canberra and Calvary Health Services with communications, with events and educational series like what we're doing today. And in 3 months' time, we've seen an increase. So in August, there were 2,490 referrals sent using SmartForms, and that's a 49% increase from general practices and specialists. So we are hoping that all of you attending this event will use the preferred method for referrals, which is SmartForms, and that please contact us if you have any concerns, if you have any questions, and if you'd like us to support your practice. All the details, all the resources and tutorials are available in Capital Health Network's website, digital health section. There's an electronic referral section in there. You'll also find resources there regarding SR Referrals, which will be our next presenter. So thank you very much, everyone. If you've got questions, you can also email digitalhealth@chnact.org.au. Thank you.
Thanks, Russ. So our next presenters are from SR Referrals and Specialists. I've said that wrong. Dr. Carmel Servan is the General Manager of Servan Media. the company providing the SR Specialists and Referral services. Servant Media is a family business that has been working closely with specialists and GPs for over 30 years. Carmel has led the development of SR both in New Zealand and Australia, and SR is now the main way that New Zealand GPs send referrals to private specialists. Joining Carmel is James Alcorn, who has worked in the healthcare sector for over 15 years. In the last 10 years, James has specialized in technology in the healthcare sector, including implementing cardiology information systems, My Health Record, and population health analysis tools. James's prior role was with the Northern Sydney Primary Health Network on 2 projects to help increase digital maturity by adopting new technology with medical specialists and the aged care sector. James has continued this work on secure messaging, working with SR specialists and referrals to help GP practices and specialists better use this technology. Thanks, Jen and Tom.
Thank you, Taylor, for that introduction. So tonight we're going to just cover electronic referrals to private medical specialists. So this is using a very similar system that's being used in the Canberra Health Service. Okay. One of the big advantages with this system is that if you get used to the workflow for referring into the Canberra Hospital, it'll be very similar for the private specialist. So we'll cover that. The areas that I was going to cover tonight were the collaboration. The other reason is why use electronic referrals, how to be set up with electronic referrals and how you might already be set up. Then we're going to do a demonstration of it from the GP perspective, so how they refer to a private specialist, and then show how a private specialist receives their electronic referrals. So you'll be able to sort of understand that process end to end and how we can help as a company with training your staff. Also, if you do have any questions, there's the Q&A button, so please don't hesitate to type those in there for us tonight. So the existing referral process is that a lot of the referrals are either being done by fax and emails, and there's a lot of challenges with that. There's also these huge information gaps as well. So I guess just digging a little bit into that, one of the big challenges has been with faxes is that you're not always sure that the fax has gone through. Perhaps if you're faxing, there might be a page that's missing or upside down or back to front or something like that. So it's not always going to be going through. The other thing is with faxes that it's not secure in that at the other end, someone can pick up that fax. You don't know who's actually going to see that information. The other one is that quite often, and we've found this with the NBN and when practices change internet provider and so on, that sometimes the fax number stops working. So that's been a big challenge, or they change providers and it's not always up to date. The other challenge has been in terms of using the different address books, that those can be out of date. So that's a big challenge. And quite often a specialist might practice at a location for 6 months and then they move to another location or something like that. The other thing is that specialists might be retiring and so on. So there's a multitude of ways that those can get out of date. What we also get feedback is from the specialist reception is that they find it challenging to find the referrals, and they'll quite often ask the patient to have the GP refax that. So the patient really gets frustrated with that patient journey, I guess. The other one is that in terms of the inefficiency, so with faxed information, quite often it needs to be retyped at the other end. So there's a lot of work that goes in with that. There's a lot of errors that can happen with typing that information in as well. So there's a number of challenges there with that. So what SR Referrals is all about is collaborating with companies to make this a lot easier. So the way it sort of came about was that Servant Media, we've been publishing this directory here for about 20 years in Australia and a little bit longer over in New Zealand. So many GPs are probably familiar with this book and they've got it on their desktop. So what we've done is we've collaborated with HealthLink, and you're probably familiar with HealthLink. It's the secure messaging service that's used by GPs and specialists to share information, and also in ACT it's being used by the Canberra Health Service as well. So what we've done is we've collaborated and combined the two. So we've combined the book and the HealthLink service to make it really easy for you to firstly find the specialist in your clinical system, and then to do that referral electronically. As a little bit of background, I guess Server Media, it's a family business that began with creating a directory in New Zealand in 1991. And then we launched the Australian directory in the year 2000. So one of the huge things that makes a real difference in terms of this information is that it's curated. By that, we are constantly checking that it's up to date, and we're doing an audit on the information on an annual basis. The other thing is that because we're working quite closely with HealthLink, if for any reason the specialist stops receiving information, we kind of know about that, so we can follow that up and make sure that our directory is up to date. We've got a directory that is published for ACT in New South Wales, and then we're doing one for Victoria and Tasmania, and they're all distributed to free to all the GPs. And we've just recently added in Southern Australia and Western Australia. Kamal, I don't know, was there anything else you wanted to add in about that? I'm not sure if Kamal's there. Okay. I'll move on to...
Yep, sorry, I was unmuted. Just to say, James, that we have been publishing SR, obviously in New Zealand, since in 2015, and we've had over 1 million referrals go through now. So it is a service which can really meet a need, and we're excited to be delivering that in Australia now as well. I'll carry on.
Yeah, I think that's one of the other things that's really important is that we've had experience doing this in New Zealand, and so it's now become the primary reason or the primary way to refer into the hospital. And the information that Russ just showed us just showed that they're now getting 49% of the referrals into the hospital. So it's really switching over from faxing over to these electronic referrals. So you're also able to do that for the private specialists now as well. Okay. Now, with the HealthLink, you might be familiar with the HealthLink service, because most GPs have this in the ACT. One of the things with the HealthLink is there's an EDI, so it's an 8-digit number, 8 digits, and that's sort of like the unique address for all the practices. So everyone has one of those addresses. It's free for specialists and for GP practices to get HealthLink installed and to be able to receive information. It's free for GPs to send the referrals. HealthLink introduced a new way of doing referrals, and they call it the HealthLink SmartForm. And the reason they've called it a SmartForm is that it's smart in that it will get the information that's in the clinical system and populate that referral, so that it saves you having to retype any of that information. You might be familiar with the My Aged Care, so they've been doing the electronic referrals there, and in New South Wales the Fitness to Drive, and ACT Health Services has been using this as well. So the big advantage is that if you get used to using it for one, you can use it for each of those. So that makes it a lot easier as you do that. So the reason why to do SR use electronic referrals is that for patients it makes a big difference, because it means that the GP sends their referral efficiently and it's being received at the other end. The information is going straight into the clinical system. And it means that there's a much better clinical handover, so the specialist has access to more information about the medications that the patient's been taking. The other one is that, I guess with the background of the Optus hack and so on, that it's never been more important that the information is protected and secure. So with the system, what it will do is it will encrypt the messages at the GP practice, and then while they're going over the internet, they're unable to be sort of unencrypted, and then at the other end they get unencrypted then. So it really means that information is very much safer and secure. For GPs, there's sort of I guess one of the big advantages is that there's one up-to-date directory. So quite often GPs will be using the letter writer in best practice or medical director, and then they've got to keep their address book up to date and so on with those HealthLink EDIs. So if those change or anything like that, it can mean that the referral needs to be redone or sent to a different practice or something if where the specialist moved to. So it really makes it a lot easier for the GPs. The other one is that the accreditation standards. So it's really ticking all those boxes for maintaining the patient privacy and also the use of encryption and so on. So it was, and also for the practice, the payments for the practice incentive around eHealth, it's going to tick those boxes as well. So it really meets a lot of those standards for the GP and also the practice manager there. All right. Now, the big advantage with SR Referral is that there's probably nothing you need to do to get it set up. It's already been set up when HealthLink was installed. So if you have the HealthLink service, you're already there and active. If you don't have a HealthLink account, you can just contact us, the PHN or HealthLink directly, and we can get you set up, and it's only a matter of hours to sort of get that set up for you. All right. Now, what we're going to do is do a demonstration in best practice, and I've got Carmel's going to demonstrate it in best practice, and then also do a demonstration of what the specialists will see when they open up the referral. One of the things that sort of the feedback we've had from a lot of the GP practices in the ACT is that we've got practices that are sending all of their referrals, and so they've been able to sort of transition. Then we've got a lot of practices that are sort of in the middle, that they've had to go, and there's perhaps one GP that's sending all of them, but some GPs are using it and not using it. Then we have practices that they've sent one or two, but they haven't sort of progressed beyond that. So we do have training available, and we could do sort of individual training sessions as well. But I'll hand over now to Carmel to demonstrate this and go from there.
Thanks, James. So I'll just share my screen.
And I'll just add, just while Carmel's getting set up there, that we're going to demonstrate in best practice, but it's very similar if you're using Medical Director. So either of those systems are fairly similar.
Yep. So hopefully you can see best practice now.
Yep, it's coming through, Carmel.
Great. So I'm on a patient record, and this is where a GP would usually be. And if they're on an older version of best practice, then they can navigate to HealthLink under View HealthLink Forms, or on the current version, they just need to click on the HealthLink tag on the top menu bar. So I'll click there. And this is instead of using the letter writer, and it takes you to the main HealthLink landing page where you can find any of the forms. Obviously, there's the Canberra Health Services, My Aged Care, and we have the SR service up here as well. So all you need to do is click on SR, Specialists and Referrals, and then you're into the main search page for SR. Positioning that. So if you know the name of the specialist you'd like to refer to, you can start typing that name, and it's a good idea to start with the surname, just because spelling and shortened first names can make it tricky. And so you can go straight in and see the profile and the contact details and all the information on the particular specialist you're looking for. And then there's also the e-refer button, and if they're at multiple locations, all those locations will show, and you just choose the applicable one for your patient. I'm not going to do the referral yet because it is live, and I'm going to go to a test specialist for the actual referral. But I'll just show you a couple of other things while we're here. So that's when I knew the specialist name. If I didn't know what specialist I was looking to refer to, I can go under category search, and we've grouped the categories for you. Obviously, it covers a wide range. So say I went into cardiology related, and it's probably a good idea to put in the suburb that you're looking in. So you can enter whatever suburb's applicable, and also change the distance. You can increase that if you're further out and want to broaden your search. Now this will bring up the list of results, and you'll notice here that for some of them there's refer to specialist, and for others there's e-refer. So occasionally you'll come across a clinic where instead of the referral going direct to the clinic, they've requested that you choose the specialist. and you can click through onto that specialist and then send the referral through. So that's there as an option. You can also, I'll go back again to that search results. So you can see most of them here are showing as an e-refer button. There are some specialists that you'll come across that are manual refer. That means you can still complete the referral process. You can still bring up the referral form and save it in your patient record. However, the referral document itself will say that it has not been sent electronically and that you have to manually send it. And that means by fax or hand it to the patient or post. So the main thing is that we're including all specialists, and as any specialists do set up with HealthLink, then their status will automatically change to e-refer. So we're syncing with HealthLink on an ongoing basis to update that status for you. You don't need to worry about that. It'll just update as the information changes. And sometimes you may notice also there'll be some cases where there's a mixture of electronic and manual addresses, just depending on the different sites and whether they're electronic yet. To reiterate, there's no cost for specialists to be set up with HealthLink and receive these referrals. There's no transaction costs for referrals going through to specialists or for GPs to send them either. So there's really no reason not to be set up, and we're helping lots of specialists get that sorted. And then just back on the main page, a couple of other things. If you are looking for any of the guides, we've got them right here. So we've got the best practice, medical director, and Genie. And this shows users in this software how to send SR referrals and all the screenshots, and also for seeing the status on your referral. So there's further detail there around the messaging around acknowledgements and that information. And the Genie guide also shows receiving referrals into Genie as well. And finally, our contact details are down the bottom. So if you ever have any queries or want to email us about an update or anything at all, feel free to reach out on email or phone. We're happy to help. So now into a referral. So I'm going to bring up our test specialist, earlobe. And earlobe is a specialist anyone can use, and you can go in and send a referral through. And it is, we've actually set up a few different addresses here, which we've labelled to help us navigate where they're landing. And I'll send one to the portal account this evening. So a portal account is available to any specialist who doesn't have compatible software. There is a wide range of software which is compatible for receiving SR referrals. However, there's the odd one that isn't. And so HealthLink have provided the portal account, which is a secure way that those specialists can still receive electronic referrals. So meaning that everyone basically can be set up to receive electronic referrals. Now, this screen will hopefully be becoming familiar to a number of GPs as you do your public hospital referrals as well. So it starts off with who you've selected the referral to go to. And then down here, you can choose the time period, whether it's a continuation or a new referral, whether you want to flag it as urgent. And if you do, you have to put a reason in. And then the main field that you must enter some text into is the reason for the patient referral. And you can browse your consultation notes and pick up notes from the history as well and drop that in. So it's a good idea if you think you may have to do this referral to one or two specialists, if there's more specialists involved in the care, to write your information in a consultation note and then just drop that in rather than retyping it into each referral. Little tip. So you just go through each tab basically, so you can see there the information. Now, bearing in mind I don't have a real patient, so I'm not going to have as much information as you'll have. So attachments. Now, this is an area which obviously is probably the area where there's the most scope for improvement, and HealthLink are aware of some of the issues with this. The first is that we are working, HealthLink are working to increasing the file size limit. So occasionally you'll find that the file you try and attach is too large, and you'll get an error message when you go to submit the referral if that's the case. And also take note, as Russell mentioned, of the document types that are available to use for attaching. So it's not all types of files. You do need to use one of the ones in this list. You can browse your local computer and choose a file there. So for instance, if the patient has emailed through a photo or you've picked up an X-ray there, you can do that. And then you just click upload and you can see it's saved here. We do know that there's an issue with IMED reports at the moment, and I know that HealthLink and IMED are working on that. and hopefully it will be resolved soon. The PDF format that IMED are using has something particular about it, which is non-standard, and that's contributing to that glitch. So we're hoping that that will soon be resolved so that those reports can also be attached. So that's on attachments, and now we can click through and you can see here your medication information will come through, and you can either edit or delete it as applicable. So you can untick information if you don't want it to come through if it's not applicable for that referral. And likewise for the medical, social and family history, you can click on anything that is applicable that you wish to include. And then finally, you need to check the patient information. So this is pulling from the patient record, and it's just an opportunity to see if there's anything there that needs updating. And then your own referrer information. It's a good idea to make sure that you do have your practice name in here. Sometimes we see main surgery appear a lot where people have left it with a default setting there and not actually updated it yet. So it's obviously helpful to do that. So once you've worked through those tabs, you can preview the referral. And this will bring up the referral as it will look when it gets submitted through. You can also park the referral if you get interrupted, or if you're waiting for some test results, that can be handy. And then you can submit the referral. If you're doing a manual referral, it won't say submit, it will instead say print. So that's just a subtle difference there, because it's not actually going to send it electronically. So I'm going to submit the referral now. And you'll see that it creates the referral document. It's telling you what it's done, and it says form sent on. So there is some other places in the software where you can review the status of the referral as it's actually delivered by HealthLink, but at this stage it's telling you that the referral has been sent. Previously, HealthLink did mention acknowledged here, and that was in the context of it being acknowledged by HealthLink, but not yet being acknowledged at this point by the receiving practice. So that's one of the reasons why they've changed that text so that it's clearer for GPs. Now moving, so that's what a referral form looks like once it's been created there. You can also see it in your correspondence out. So we should see the referral form that I think I might be on a different, just check I'm on the same patient record. And you can also go back in and open a previous referral. So you can go back in and see it as well. I'll just, sorry, navigating on my windows. So that's a referral gone through. It's a good idea to test it and have a play, and you can use Earlobe to do that yourself as well. And now I'll just flick over and also show you what happens at the specialist end. So now I am in Genie software, and there may be some specialists on the call familiar with Genie. It's a widely used software by specialists. And all we need to do is go to open incoming letters. And when we go into here, our default view is unlinked, which means that they're new letters that have come in which have not yet been linked to a patient record. And so there's a very simple process for this. We just click on the first referral, and you'll see here's the document. So they've got a preview of it here. You can see that it includes the attachment. So in the version that the GP sees, it doesn't actually show the image in the attachment. It references it down the bottom, but in order to keep file sizes down, it doesn't show it actually on that document that they're going to, but it does show it when it comes through to the specialist. So just reiterating, it is there. We do sometimes get queries on that. So up the top here is the patient name, NGV, and you can see some green markers which indicate that for this referral, a match has been found in the patient record. And so all that the specialist staff need to do is click link. And that's going to link that referral to that patient record, and it's actually automatically stepped to the next referral letter in the list. And this one's another one that it's found a match on. So again, all they need to do is go link. And then the next one, now we can see that we've got some red markers, and this indicates that it hasn't found a match to a patient record in this practice software. So now there's a second step to do, which is to go new. And what's happening here is there's a new patient record being created in Genie automatically. So all that needs to happen is that gets saved. And now it's changed to being able to be linked, and the referral gets linked. So this process, and I can do it again on this one. So again, I'm going to go new to create the new patient record, check the details, and then again to save it, and then again to link it. So you can see how simple this is. And the beauty of this is, unlike a fax where staff are manually typing in the phone numbers and all the detail for each patient record, it's all happening automatically. So we're getting a lot more depth of information and a lot more accuracy happening at the specialist end as well, not to mention making it easier to find patients and their information. Now, it may be in some practices where they've got a lot of referrals coming through that they might not create all the patient records straight away. But even if they're looking to check with the patient first if they're coming, it's easy to find the name of a patient when they phone in. So for example, I can look up PUMP and up comes the name of a patient that might have just phoned in to see their information. And so hopefully once more specialist staff are using the incoming letters in this way for these referrals, there'll be less requests through to refax referrals. And so we're actively doing lots of training at the specialist end showing them this as well. And in fact, part of our process is when a specialist receives a referral from SR for the first time, we do phone that practice and check that they know to look in incoming letters or the equivalent in the software that they're using. And we do offer any support and training if that's helpful, if just to help them on their way, changing from faxing to receiving electronic referrals. Now, James, if I missed anything, anything else that would be good to cover off there?
Yeah, we had one question come through about how to see the acknowledgement, so the question was just, that they could see referral has been sent and referral has been sent and acknowledged.
Okay. Happy to help. So I've gone back into best practice, and there's the equivalent screens in Medical Director as well. I'll just go hunting for them here. So under, I'll actually close out of the patient record for this one. Oh, hang on just a moment. Right. So under, I think it's under clinical. I'm just looking. I'm looking for the view, sorry, HealthLink forms. So there's actually a couple of places here. I'll go to HealthLink forms first. So I've just brought up a big list of forms that have been sent through, and you can refine this by status. So here you can see a range of statuses. So I could, for example, go and see if there's been any that have been rejected. I haven't found any. I can find the parked set of referrals, so any that have been parked that perhaps need to be checked if the results have come through and we do want to on refer now. Completed. Now, my understanding is that completed is that it is the equivalent of acknowledged at the GP, at the specialist end. And what else have we got there? And there's also another view, which I'll bring up as well. So it really is dependent on how best practice is presenting this information. Now here we have, now this is probably a better view for what you're looking for in relation to this, what's happening at the specialist end. And on this view, it defaults to hide positive acknowledgements. So if I untick that, I can see the acknowledged status here. And also I've got waiting for acknowledgement on one there as well. So waiting for acknowledgement means that referral's been sent through, but possibly the specialist receiving software hasn't yet connected to HealthLink and downloaded that referral and said that they've got it. So that's a step as well. One thing to be aware of is that in the HealthLink process at the moment, when the referrals are delivered, it isn't a real person sending you back a message automatically. It's the software saying, yes, the referral's been received. So that's just something to be aware of. If you're dealing with a really urgent referral and you, have a particular concern for a patient, then we would always still advise ringing the specialist practice just to make sure that they are are processing that referral with urgency. So as much as this process will streamline referrals going through, it doesn't take away the, the benefit of always being proactive in the case where there's, particular concern and you see a need to follow up on that as well. So we'd still advise that. Any other questions at this stage? Or
That's the only one.
Yep. Okay. All good. I'll hand back to you then, Eric.
All right. Okay.
James, sorry.
Yeah. All right. I'll just share my screen here. Yep. So I guess the main thing with for practices is that we have training available, and quite often what we've found is that GP practices that they just need to perhaps be shown this, and what we recommend is that there's a quick start guide that is available, and just printing off a copy of that and walking through and doing a test referral to ELO. For specialist practices, some of the feedback we've just had is that quite often there's been staff changes and so on at the practice. So it can be helpful to learn, I guess, train all the staff on how to find those referrals, because it does really frustrate the patient and the GP to be asked to refax that information. So hopefully through this demonstration, you've seen how easy it is to do the e-referrals, and we've had GPs that tell us that they save quite a bit of time by doing the electronic referrals. So GPs who are doing a lot of referrals can save perhaps an hour a day. And the real beauty is that the information that's in your clinical system can automatically populate into those electronic referrals. So if you do want any assistance, we've got a 1-800 number, 1-800-147-047 that you can contact us or email us through there. And also information will go out with the package. So I'll hand back to Taylor now, I guess, and go from there.
Thanks, James and Carmel. Just a quick reminder to our attendees to keep those questions coming in the chat if you have any, so we can discuss them live for everyone during the Q&A session at the end. And now, last but not least, to talk about secure messaging and My Health Record, please welcome Dr. Kathy Rainbird. Dr. Kathy Rainbird holds a PhD in behavioural science in relation to medicine and is a manager of education and adoption at the Australian Digital Health Agency. Kathy is based in Western Australia and has been working with Aboriginal medical services and other healthcare providers across both WA and nationally, training them in the benefits, features, and clinical use of My Health Record and other digital health tools. Thanks, Kathy.
Thanks very much, Taylor, and hello everyone. Pleasure to be here this evening. I won't reiterate the title because Taylor just went through that, but I guess one of the things to point out is that I'm from the Australian Digital Health Agency, which is the national agency which is helping with rolling out the digital health tools that we're talking about tonight. Secure messaging being one of those, but we're also working across a number of other digital health tool spaces. And we have some other projects in the background that are coming soon to help support your use of those tools. So I'll give you a little bit of update on those as we go through. As Russ already did at the beginning of the session, I'd also like to acknowledge the traditional custodians of the land that we're meeting on this evening and pay my respects to their elders, both past and present. I'm speaking to you this evening from Menang Noongar country, and I'd particularly like to extend my respect to them and their elders, as well as welcome any Aboriginal or Torres Strait Islander people who might be joining for this session. So the key digital health tools that the Digital Health Agency is particularly progressing, and which you've probably and hopefully heard of, secure messaging being one of those, telehealth, and My Health Record, the big ones. We're also working on a new product. Oh, sorry, just lost my vision there. That's coming soon, which will be supporting secure messaging, which will have a shared address book. So you can publish your practice's information in one place, and that'll be shared across a whole lot of business partners to save you having to re-enter that in. The other big one that we've had this year, or the past couple of years, of course, is electronic prescriptions, which hopefully some of you are already using, which of course has been fast-tracked as a result of COVID-19 and people needing to get their scripts without having paper. But the focus for this evening is on secure messaging and My Health Record. I won't go into too much detail on secure messaging because I think the previous speakers have both covered it very well, but just to say that the agency is very supportive of secure messaging and encourages you to use it because it is a very much more secure and safe way to transmit your information to your referrers or to your specialists or to the person who's referred you to you. My Health Record, in contrast, I guess, is a point we call secure messaging point-to-point communication because it's from one healthcare provider directly to another. But My Health Record is what we call a point to share. So it's having that information available wherever the patient goes and making sure that any clinician who then has an interaction with that patient has that key health information available that might help impact that person's care and improve their patient outcomes. So I'll just go briefly through an overview of My Health Record, and apologies if you're already familiar, but I guess the key message is that if you aren't currently utilising My Health Record, I would really encourage you to start looking at it because you'll find more and more information that's available to support your practice, and also making sure your local clinical records are up to date so that when you do come to creating a referral or uploading information into My Health Record, then that is accurate and up to date and can be relied on. So one thing to point out is that My Health Record doesn't replace your existing clinical information systems or your clinical records. It is a secure online summary of the key information about an individual. It doesn't it complements your existing systems, doesn't replace those. So it can give you access to information you otherwise haven't directly received. And that's the beauty of it, because you can immediately see a whole lot of information that may not have come through. Either there may have been, say, a patient that you've received a referral for some time ago. They've had a few other health interactions since that referral was generated. You can find that new information by having a look in their My Health Record. It is personally controlled in that an individual gets to choose whether or not to have a My Health Record, but as you'll see in the following slides, most people in Australia do have one. And there are controls that the individual can put over their own My Health Record in terms of allowing access to only certain healthcare clinicians or organisations. But the beauty of it is that it is there to support better care. Most people understand that it's designed to have that key information available wherever they go. And it has been set up with a security prime in mind. And it is part of a national system. So it helps cross and overcome those fragmentations and silos that exist across the healthcare system. So it works nationally, both between public and private sector clinicians. If you're working in your private rooms and then need some information that's in a person's My Health Record, you can also access it in the hospital. Likewise, the hospital can upload their discharge summaries and you can see those in your private rooms. Also useful for people who are travelling between the ACT and other parts of the country. Many people travel, north in winter or whatever. That will be available if they end up seeing someone else in Queensland, say, for instance. It's accessible at all times, provided the internet's not down, and it is protected in a number of ways. And one of the key ways is that all the software that connects to My Health Record, usually it's just a little icon button that you can then click on, a bit like Carmel showed with HealthLink, My Health Record access, but it is protected, and all the software has to go through a very stringent conformance process to be able to access and interact with My Health Record. And there are digital security certificates that work in the background to ensure that the information is transmitted securely between the system and your computer systems. So as I mentioned, most people in Australia have a My Health record, and that's actually been increasing over time. I think initially some people chose not to have one, but now more and more people are opting in. And more importantly, I guess when it first started, there wasn't necessarily a lot of information in a person's My Health record. It really builds up as people interact with the healthcare system. But because of COVID partially, but also because there's been more time and we have more connections, that information is really starting to build. So it's becoming a real value proposition for you as clinicians to think about looking at a person's My Health record, and you may find some really valuable information, as I said, that you haven't previously received. In terms of what is inside, these are stats from July this year. You can see there are over 289 million clinical documents already available in the system. That was of July. And that's coming through from hospitals, both public and private. We're starting to connect more private hospitals, pathology labs and radiology services, as well as you as individual clinicians, either in your private practice or in general practice. Medicines information, of course, is also available. There's also Medicare information and information that the individual consumer can upload if they have, say, a significant allergy. So the Digital Health Agency has been working with key stakeholders across the country to encourage greater connectivity and use of My Health record and getting that connection so that that key information can be uploaded into the system. We've been working with PHNs or primary health networks across the country, and they have been actively engaged in getting GPs and pharmacies connected in the first instance. We've also been working with state jurisdictions to get those public hospitals connected and uploading their discharge summaries. And more recently, we've been working with the specialist software vendors to integrate with their products with My Health record. And now that's a focus for PHNs and others to increase specialists to actively use the system so that their letters will be able to be uploaded and viewed by any other healthcare provider who's involved in that person's care. The really good news, and the thing that I like to point out on this slide, is that at the hospital end, these documents are being accessed, My Health records being viewed. You can see over the last 12 months from July 21 to 22, 1.94 million views of My Health record occurred. So that information is coming through. When you upload, say, a shared health summary from your general practice, that's really valuable for those hospital clinicians, especially if your patient has a number of complex conditions and medications. They can see that history and that information through by looking at that shared health summary that you've contributed to their record. So really valuable for you to both view the information, get that information quickly to hand, but also to make sure you're contributing your information that may be really useful for other clinicians to be aware of. So this is a list of the current documents that can go into My Health record. And I say current because the agency is always working to improve the system. We're working on new documents that can potentially be added into the system, and also new ways of integrating that information and making it easier for you to quickly and easily find what you need. But the main documents currently available, you can see the healthcare provider documents listed on the right-hand side of this screen. So the main one that if you're a GP that you're probably involved in uploading was what's called a shared health summary. And for any specialists on the line, that can be a really useful document to refer to if you want to get a bit of background history about a patient. If you need a bit more detail, that shared health summary includes things like allergies, adverse reactions, current medications, past medical history, and some immunisations information. I won't go through the full list of all of those other documents, but hopefully most of them are fairly familiar to you. If you've got any questions, feel free to post them in the question pane and I can come back to those. I just wanted to point out also that individuals can add information, as I mentioned, if they have, say, a significant allergy, that can be included, or if they have advanced care planning documents, they can upload a copy of those into their My Health record. So worst case scenario, if they do end up in hospital and it is at that end of life stage, the clinicians there can see what their patient's wishes are. Medicare information also comes through into My Health Record, and that can be really useful in terms of seeing who else has been involved in your patient's care. So you can actually see each of the claim items by item number and the provider's name and details. So a lot of clinicians say that that in itself is really gold, and because that's automatically generated through Medicare and comes into My Health Record, it doesn't rely on it coming from any of the other parts of the system and being uploaded. It just comes in. So it's pretty well always there to some extent for most people, unless they've been completely well and haven't had any interaction with the healthcare system. And of course, particularly relevant if you're involved in giving people vaccinations, is looking at their Australian Immunisation Register, which is visible directly through My Health Record without having to log into the separate AIR portal. So you can just click through their My Health Record and see their immunisation status. And that is a direct feed from AIR. In the centre of this slide, we've got some overviews which pull together information about documents that are across My Health Record and brings it into an easy way for you to find. So that medicines information view, for instance, brings any information about medicines or allergies together into a single screen. So you can see a list of them and you can click and find the key document that relates to that medicine. So these are just some screenshots to take you through what it looks like. If you're a GP, hopefully you're already familiar with shared health summaries. If you're not, please attend one of our training sessions which show you through uploading of shared health summaries. It's very easy. It's been integrated into your software. It extracts the information from your existing clinical information. You should make sure your local record is up to date and complete before you do that uploading. And as I said, it includes these headings that I've outlined here. I should point out that all these screenshots are just to give you an idea of what it looks like. This is all fictitious data, a fictitious patient, but it just has this standardized look and layout so that you can become familiar with what that looks like within the system. This is a screenshot of that medicines information view that I mentioned, so really useful, and some clinicians say that they use this as their go-to part of My Health Record if they're seeing a new patient, because it has this navigation panel at the top here where it has allergies and adverse reactions. They usually appear first, then the medicines preview, then the most recent shared health summary if there's been one uploaded, and a discharge summary linked to the latest discharge summary if there has been one. So straight away, you've got hyperlinks to all this key, really useful information for a new patient. And of course, the medicines preview has a list of any medicines from across all of these documents. As I mentioned before, it could be coming from any one of these, listed by the medication, active ingredient, brand, dose and directions. And over on this side, you can see the source document with a hyperlink through to that specific document, so you can go to it if you wish. One thing to bear in mind is that, yes, there can be information here that is old or out of date, and you may need to keep that in mind when you're looking at this list and consider having the discussion with the patient about whether they're still taking that particular medication. It doesn't necessarily get taken down, but builds up over time, if you get what I mean. This is just a screenshot example of that allergies view. So of course, if people have significant allergies, really useful for that to be made available wherever that person goes so that they aren't given anything that is contraindicated. This is just an example of what the hospital discharge summaries can look like. Some hospitals are uploading them in this format, which is in our clinical document architecture structure. Others are attaching them. So if you see a document like this, but with a hyperlink, a blue hyperlink, generally it means you can click on that link and it'll take you through to a PDF version of that discharge summary. So of course you can see all the details here, including administrative details of where that was created, which in this instance is Canberra Hospital. Another overview that may be of interest is the pathology reports. So again, consolidating any pathology reports that have been uploaded into the patient's record, again with a hyperlink through to the most recent reports listed here. This is ordering all of the reports across their My Health Record by date, The most recent one is listed here, and again, clicking on that hyperlink will take you straight to that report, and you can open it up and have it at your fingertips, which is really fantastic if you can see a report that you weren't the original requester of. You can access it directly through My Health Record, which means you may not have to repeat that test, that you can see within their record straight away. So if someone says, oh, I had a test for such and such last week, have a look at their My Health Record, it might be in there. I should point out that not necessarily all reports are, because not all labs are connected, but Russ and Taylor can probably update you in terms of the connectivity in ACT, but most labs are working towards being connected, and we are also working with the diagnostic imaging services to upload their reports as well. This website will also guide you through who is actually uploading at the moment. Some labs do need to have a request received as an e-request, which just basically means it has a barcode printed on the bottom, but there's guidance on that webpage as well about that. So in terms of benefits, I think the key thing is that My Health Record can mean you can get quick and easy access to key health information that's not been received directly, saving you time, saving your practice time, saving administration, all of that, and meaning timely treatment for patients. So rather than having to rebook a consultation because you haven't got all of that information, you can get it straight away and you've just got it immediately as needed. For specialists, if you do upload your specialist letters, not having to repeat send those to another clinician who requests a copy of that, you can just say, if you've got access to My Health Record, it's in there. And of course, improving clinical decision making by having that patient-specific information available when it's needed. And as I just mentioned, avoiding the duplication of tests if you can see the ones that the patients recently had completed. So I'm just conscious of time. I'll quickly go through how it works for you if you are in private practice. Hopefully most of you are already registered and set up to use the system. But if you're not, this bit is for you. Basically, you can either use My Health Records through the software, as I mentioned, that's gone through that technical process of getting integrated with My Health Record. And we have a list of the software that's been through that process. As I mentioned, we have had a recent software industry offer, particularly for specialist software vendors. So quite a few of them are coming on board at the moment with integrating and making it easier for you to utilize the system. Don't despair if your software isn't on that list, because as I said, many of them are working towards it. But there is another option as well. There's a free portal where you can view the information without the need of software, and that's called the National Provider Portal, which you can log into and view the information. You can't upload through the portal, but you can see the information that's available for the patient there. This slide will be sent out in the pack, and it has direct hyperlinks to the relevant parts of our website, which will guide you through any of these steps if you need help with any of this. One of the things you do need to make sure is that in your practice, you have a My Health Record security and access policy in place, just to guide your staff in terms of using the system and to make sure they're using it appropriately, especially in our current times with cyber attacks and so on, being aware of not sharing passwords and making sure they are authorized to use the system before they access and view someone's record, using it for legitimate purpose, which needs to be for the provision of healthcare. You do need to go through a process of getting registered to set up to use the system. Hopefully most of you've already been through that process, so you don't have to go there again, but we have updated our website. It's really straightforward to read through that step by step, or we've got guidance on supporting you with that. You should also make sure your staff are trained to ensure they are using the system appropriately. And we have a whole lot of fabulous e-learning resources that you can utilize for that purpose as well. In terms of getting connected and starting using, as I mentioned, the website has a full list of the sort of things that work in the background of the system that you need to have in place. You need to get registered and have your software set up and configured. To go through that registration process, you can look at the details on the website, but you can also contact our helpline. We actually have a team that can guide you through that connections process. or you can contact Capital Health Network, Russ and Taylor and team, and they can support you through that as well. If you are working in a hospital as well, then you should have a chat with your clinical informatics manager or your quality manager and ask them about how you can access My Health Record through the systems within the hospital, and in particular through the Canberra Digital Health Record. And also check the hospital's local intranet for information on that. I won't go into too much detail on secure messaging. I think that's been covered by the other presenters already really well this evening, but just to highlight that it is really important to emphasize that it is ensuring that that information is transmitted in a safe and secure way. And it is encrypted to ensure that that's transmitted information can't be accessed by others, and is much safer than using other means such as fax or snail mail, which can of course go astray. We've already touched on this, but basically you as a provider create your message, it goes through that secure messaging supplier that does that encryption and holds that message where it's then stored until the receiving provider accesses it through their software, as Carmel demonstrated. And I think we've already touched on all of these benefits, but I think the ultimate goal, of course, is improving patient outcomes, improving clinical care, making sure people get the information that's needed when they need it, and ensuring that information is transmitted in a secure and safe way. Very quickly, just pointing out some useful resources. The agency has a web page specifically dedicated to secure messaging with some guidance, some frequently asked questions and an implementation guide. The web link's on the bottom of this slide, which will come to you in the slide set. And we also, as I mentioned, have a whole lot of different resources to help you stay up to date with digital health. The e-learning modules are fantastic, and there's a great module about cybersecurity in that space as well. We do also run demonstration sessions of using My Health Record in your different clinical softwares. You can see those through this events and webinars link. We have a range of other resources. And if you do want to organise a specific session for your team, our education team can be contacted via this email address, and we'd be happy to arrange that for you. Thank you very much. Thanks, Taylor.
Thanks for that, Kathy. We will now move on to the question and answer session. Thanks everyone for your questions and comments. I'll be asking them now to the panel for our presenters' responses. So over to the chat quickly from Said. How large of an attachment are you allowed to send? Referral doesn't accept large file attachments. I'm not sure if that's for SR or for HealthLink, but let's answer for both just to be fair.
I think I can answer that. In all the resources that have been provided by HealthLink SmartForms, it says that the maximum file attachment is 3.7 MB. But as Carmel mentioned in her presentation a while ago, HealthLink is doing something about it and is thinking of increasing the maximum file size limit. And I think that's the reason as well why pathology reports are not coming through, or sorry, diagnostic imaging reports are not coming through, because they are big in file size. Thank you.
Just to clarify on that, in My Health Record, you can see the reports for diagnostic imaging reports, just not the images.
Great, thank you, Kathy. So over to the Q&A again. Got a message from Tracy saying once referral has been sent, we get a message saying referral has been sent rather than the previous referral has been sent and acknowledged. It's very different from our end. Now, I think Carmel touched on this in her presentation, but Russ, do you have any further explanation on the HealthLink SmartForms side of things?
I think it's the same thing. They reworded it because I think it caused some confusions to our healthcare providers when it says sent and acknowledged. They're thinking that the Canberra Health Services acknowledges receiving the referral, when in fact it's HealthLink who acknowledge that the referral has been sent electronically. But with the digital health record, that's what everyone's been waiting for. The central intake team would be able to tell you the status of your referral. It would even tell you the triage and appointment booking. So we are all looking forward to that functionality from digital health record.
So the next question in the chat, can I assume that specialist reception staff will contact the patient on receiving the electronic referral, i.e. the patient doesn't need to ring the specialist rooms to arrange the appointment?
Shall I give an answer on that, James?
Yep.
So there is some variation, we know, in how practices deal with referrals. In a lot of cases, yes, the specialist staff will ring the patient. However, there are occasions where there's very busy centres which have a lot of referrals coming in. And in some of those cases, they're not as proactive, and it can take a few days, or it may even be that they prefer the patient to phone and make the referral. We are encouraging specialist staff where that is the case to let us know, so that we can start to provide that information on SR at the point of the referral going through, so that it's clear to the patient as well what the status is. So that is an area which we think could be improved in terms of the communication, and we're looking to assist with that.
Awesome, thanks, Tanya. So the next question we have, why are there such tight word limits for clinical reasoning in the referral box on public referrals to CHS? This is very restrictive, especially for peds, rheumatology, neurology, etc.
That one is a HealthLink technical thing with the limits. So thank you for pointing that out to us. We will report that back to HealthLink. But there is also a way for, if you want to give more information for that particular patient, you can always attach a document or a letter stating all the reasons, clinical reasons for your referral. But yes, thank you for pointing that out, and we'll report that back to HealthLink team.
Fantastic. So the next question we have, I'm concerned that the parent of a mature minor under the age of 14 can see that their child may have had a pregnancy test or received a service attached to a contraceptive, e.g. implant. I assume this is for the My Health record, so I might pass this one over to Kathy.
Thanks, Taylor. So yes, up until the age of 14, like the Medicare records, that is visible to the parents or guardian of that young person. And if they have had something that is sensitive that they don't want visible, they would need to ask that that clinician doesn't upload that information as a first point, but also in terms of having that Medicare information blocked, I think they would need to contact Medicare Services, because it's that Medicare claim item that would show in both Medicare data and through My Health record. So it's not just My Health record where that could be potentially visible to the parent if the parent was switched on enough to go and look at those things.
Another question about My Health record. If My Health record does not allow us to upload a summary, does that usually mean that the patient has declined a My Health record?
Not necessarily. It depends on your software and your role and whether everything's been set up correctly in your system. If you're getting an error message when you're trying to upload a shared health summary, or getting some sort of knockback, then please get in touch. And if you can get a screenshot of the error and send it to our help team, they will escalate it through to the relevant people and give advice. But in that screenshot, make sure, of course, there's no identifiers for the patient, just the error message itself. And if you send it to help@digitalhealth.gov.au, that'll get triaged and sorted out. But usually it's something in the background that's not working, rather than that the patient has said, I don't want information to go into my health record. And you can always check if a person has a My Health record by clicking on the button in your software and see if they have one.
Great, thanks. So the next question, how do patients get a copy of the referral you are sending electronically? Are they able to see what is in the attached document? Not sure if this is for SR or HealthLink or both, so I'll pass it over to James and Carmel first, and then maybe we'll go on to that.
So I think, oh, sorry, James, you're on mute. I was just going to say, I think it depends on the software, what functionality they have in relation to sending information on to the patient. SR does not automatically send on the referral document to the patient. And also for the attached documents, you would need to print those off separately or attach those separately as well. It is an area which we've got a request in for more development. However, that will need to happen probably both at HealthLink and at the software's end on each software as well. So it may take a little bit of time for that to come through. But by all means, those sorts of requests are helpful because it does flag areas where there could be more functionality that's supportive of the patient. I'm also keen to see the ability for referrals to be passed to My Health record. I don't know, Kathy, if that's an option coming soon.
That would be great. There is the ability for My Health record to accept e-referrals, but they have to, again, go meet that conformance requirement. So if you're keen to do that, that would be great to progress.
Yeah, so I think it will be a case of HealthLink and the practice software working together. So we'll continue to request that as well. And yeah, Russell, have you got anything to add on your end on that?
Yeah, so yes, as you've mentioned, one thing, unfortunately, is printing and giving a copy to the patient, because once a referral is sent, a record is kept in the patient's file. For a clinician, that's normally in the correspondence out folder in your practice management software. So yep, you've got to print and give it to the patient. But what we are hoping with the digital health record, because HealthLink SmartForms is integrated in digital health record, we are hoping that when the patient app is fully functional as well, that they will be able to see all their documents, all their appointments, all the referrals in their app. But we'd have to wait for further announcements from ACT Health and the digital health record team regarding this one.
Awesome. Thanks, guys. I think that also kind of answers another question in the chat about whether or not to give copies of referrals to patients. So we'll move on to the next, which is some specialists do not check for new e-referrals routinely and tell the patient they have not received them. This is very frustrating. It's more of a comment than a question, but if anyone has any advice for this person.
I think probably the best advice is, yeah, if the GP can print off a copy and give to the patient, so the patient does have that copy when they sort of organise the visit to the specialist. That seems to be the best one. But yeah, we do have those frustrations. I guess perhaps just some general feedback. What we found is that as specialists have, I guess, joined the profession, we find that the new specialists are all, I guess you'd say, digital natives and so on, that they've been, but there are some specialists who, yeah, I guess they're just very embedded with that workflow with the fax machine, and we're just going to keep working on them. But yeah, I guess the best workaround is always give a copy of the referral to the patient. In terms of also, some practices do tell us that the GPs and the practice have policies around emailing a copy to the patient. So I guess that's something that workflow that the practice could work on as well.
One other thing on that, feel free to contact SR, just email us through, and we're happy to then reach out to any specialist practice that you think may need some more training and offer that training to them. So we are being proactive, both at the GP and specialist end, offering more training, and we're happy to do that if there's anyone in particular that you think that might be helpful for. We can do that in a way which is yeah, just as part of our normal service, and we're happy to do that. So as well.
One other piece of advice that we tend to give to practices is to add a little clause on the bottom of your referral letters to say that your preferred method of communication is secure messaging, and that makes it clear that you'd rather have them communicate that way, so that information can be exchanged, and providing those identifiers so that they can communicate with you and find you as needed.
Awesome, thank you guys. We've got another question. One specific public endocrinologist tells patients that she cannot see the results of tests done by the GP and often repeats or tells the patients that their GP has not sent them. However, they are attached to the e-referral. Can she truly not see them, or does she just need further training?
Sorry, was that an e-referral question?
Yes. Specifically about viewing reports from a public endocrinologist side of things.
I guess one thing that we do some training with the GPs and also the specialists. So when creating an e-referral in the clinical system, and then the attachments, when the GP goes and sees the final e-referral, you can't see the attachments. It just says that the attachments are attached. When they do go through, the specialist does see them. It does sound like it's a little bit of perhaps training on that one. On a previous project, I actually worked with an endocrinologist, and one of the tips they told me was that specialists can request through their pathology company to have global access to pathology, so they're able to do a much broader search on the patient. So that's something, but yeah, it does sound like it's a little bit of a difficult one. But yeah, I guess perhaps if the patient has a copy of the e-referral with that, and if the GP prints out those tests and educates them a little bit, that might be the workaround, but it does sound like it's quite frustrating for the GP and patient there.
I think I would suggest that if you can send the details of that endocrinologist to our teams, to James and to CHN, and we can support that practice with regards to using SmartForms and SR Referrals.
Guys, yeah, so the contact information for everyone who is in this panel will be in that post-event email for you guys. So feel free to send through those details. And they've just replied, it definitely doesn't happen with the other endocrinologists. So it sounds like a very specific issue going on there. So if that's all the questions, which I think it appears to be, we'll wrap it up a little early. So thank you again to all of our speakers and to everyone who joined us in tonight's webinar. There'll be a very short post-event survey that will show up on your screens shortly. We would greatly appreciate your responses to that. We'll also send out an email which will contain the webinar's recording and other useful resources related to today's topics. So thank you all and have a good night.
Thank you, Taylor.
Thank you, everyone. Good night.
Good night.
Thank you, everyone, and good night.